want to start this month's team brief by talking about patient safety. Clearly, patient safety is our number one priority, and we've done really well on this over the last few years. But I think it's now time to really reinvigorate the patient safety campaign. There's been a few instances over the last few weeks. We've had a couple of NEBA events, we've had some C. diff incidents, and our performance against the 95% target. All of these have patient safety implications. So now is the time to re-emphasise what we do around safe, personal and effective care, and to really start big conversations around our patient safety campaign. So please watch out for this over the next few weeks. We're now about to enter the final period of the financial year for 2017-18. Finances within the NHS is always a continual issue. We have some strains, to be fair. We have a cost improvement programme of in excess of 17 million, and we're achieving currently round about 9 million. So that leaves us a gap around about 8 million. So can I ask you to all think about efficiencies and to redouble our efforts in terms of our financial position. Some really good news is that we now have next week the opening of the Lancashire Elective Care Centre on the Burnley site. I'd just like to say a real thank you to all the staff who've been involved in the work on this development, and all the staff who have been put out through the work that's been going on but have continued to deliver tirelessly safe, personal and effective care. This is a great investment for our trust and a great investment for the Burnley site. So thank you to everyone involved. Continuing the theme of good news, ELHT is one of 12 organisations within the North West who have received a silver award for employer recognition in support of our armed forces. Paul Griffiths received this reward recently on behalf of the Trust, and is great recognition for the work we do in support of our armed forces, so thank you. I'm sure many of you will know Professor Iqbal Singh, one of our long-standing geriatric consultants. Professor Singh has been working tirelessly over the last few years and has been lucky enough to receive a large sum of money to support and set up a new unit looking at safety in the care of frail elderly. Professor Singh has been working with Health Education England to set up this centre and has received funding. The centre will be based within ELHT but will support services on a nationwide basis and is looking at safety and is looking at dignity in the care of elderly patients. So well done, Professor Singh. You put ELHT right at the centre again. Thank you. And finally, this month's guest speaker is Phil Denny. As you know, Phil works for Occupational Health and has been working tirelessly to get our numbers up with regard to the flu vaccination campaign. Phil will be speaking about what this means, and let's get one last push to get our numbers above 85%. Well done, Phil, and your team.
Hello, my name's Phil Denny. I'm Head of Occupational Health and Wellbeing at East Lancashire Hospitals Trust. I work with a team of nurses, physiotherapists and wellbeing practitioners to look after the wellbeing of the staff here at East Lancashire Hospitals. One of the big things that's the hot topic at the moment, certainly with the time of the season that we're at, is the flu vaccination programme that Occupational Health lead on. We're currently at 72.4%, but what we want to do is try and get a lead target of 90% of the organisation. It's really important that we do that because not only does it help us look after our staff and the colleagues around us, but also patients and family members. But if you think we're the biggest employer in the East Lancashire area, if we vaccinate 90% of our staff, we're not only collecting those people, but actually we're helping those people out of the hospital as well, which will hopefully help prevent hospital admissions with anything such as influenza.